40,000 people could die in the U.S. from coronavirus.
Today, I have declared a public health emergency.
Another big increase in the amount of coronavirus cases being reported in the state tonight.
Well, the Wisconsin National Guard is now activated.
There are thousands and thousands of stories of patient harm due to the shutdown itself.
But experts say the isolation can also cause depression, poor sleep, heart, and immune problems. It's not healthy for us to be isolated for long periods of time.
As we've all seen during this crisis that we're in right now, mental health issues are more important than ever. People are reeling under the loss of income, the loss of social interaction, and just having to stay at home and be safer at home.
We have seen an increase in the anxiety of, I can't get into a shelter, or I know my name's at the top of the housing program, but nothing's moving off of that list. So while the need itself hasn't increased, the anxieties out there within those that we serve, that has increased.
I was really worried that all of the students that were kind of on my roster, things would go really chaotic for them and things would be really challenging. However, I found out really quickly that for them, staying home and doing online work in a virtual setting was a lot less impacting on their mental health. And so I've seen a decrease with those students, but an increase with the other students that are used to going to school to socialize. And so being able to connect with them virtually has been really important during this whole pandemic so that students still feel connected even if they aren't in their school or their natural environment.
We are helping ensure that the individuals that we work with who are experiencing homelessness, the NAMI Waukesha PATH team, we are handing out face masks if they are requested, hand sanitizer, and bottles of water, stuff like that.
NAMI Waukesha and our staff pivoted very quickly to take most of our services off-site to be able to continue to provide them seamlessly. However, many of the clients that we work with do experience homelessness, and so we have not been able to go completely off-site with those services. We have expanded our platforms to be using virtual options as best we can, and we will continue to utilize these options as we move forward so that we can meet the needs of everyone in our community who is struggling with mental health concerns.
You know, we have a population that has a lot of underlying health conditions. Some severe heart conditions are out there, a lot of diabetes, and it just raises their anxiety of what if I catch it? Am I going to be okay? And staying in shelters, if one person catches it, it can spread like wildfire.
At NAMI Waukesha, we have done a phenomenal job of outreaching to our youth. Lexi immediately changed the way that she was providing services, opening her phone as a text line, appearing in virtual classrooms.
We're all impacted by this and we're all just trying to do the best that we can. So the more that we can come and virtually connect with each other, I think the better that it's been for other people to feel like, okay, yes, this is a little bit different and yes, I might be struggling, but there are people who I can connect with.
I think it's important to know that NAMI is a resource for help. And knowing that is really important. If you learn nothing more than you've got a person to help you get you to where you've got to go, because you have to advocate for your sons and daughters and loved ones, that's the importance of NAMI, is a resource. Stop the what ifs. You know, if your son had cancer, terminal cancer, you wouldn't go, what if he's going to be a doctor and what if he's going to be a lawyer? You'd just be happy that they're going to be healthy. And so I accepted that my boys were healthy and that they were through the process. And so I wanted to go back and tell people to start thinking that way, to start thinking that mental health is a health issue. And what NAMI is all about is it's okay to have mental health issues. And it's okay because you're working your way through the process.
One of the things that I really wish people would remember and realize is that this need for homeless services, it's not just a winter or Christmas time need. It's not just a holiday need. It's not just a COVID-19 need, that there are people experiencing homelessness year-round.
Supporting NAMI financially, it's a good way to keep these family programs available and to keep them free to the public, and that's very important. I know that the 2 family-to-family classes that I taught, to go away with all that knowledge and to know that that's all free and provided by NAMI is an incredible support to the community.
So we are letting people know, those who are literally out on the streets within the community and also our community partners, NAMI Waukesha County is still here for them. We have never closed our doors throughout the COVID-19 crisis, and we will always be here for them.
We believe that everybody should have the access that they need to mental health services, support, and especially that emotional connection, because you are not alone. We are not alone. We are in this together. We are stronger together. And because of your generous support, we have been able to offer our services at no cost throughout this pandemic without interruption. And we need your generous support now more than ever to continue to offer our services in the coming months and years. Your support will help us provide mental health for all.